moving on to the next question. So we have a question that goes, my uncle has been experiencing back pain for months and now he's having trouble moving his legs. His MRI showed a mass in his spinal cord. Could this be cancer and will he need surgery?
Yes, the answer to that is to both parts of that question. The answer is yes. Could this be a tumor in the spinal cord? Is a very serious thing. Many tumors in the spinal cord are cancerous, but even those that are not cancerous can be quite dangerous because the spinal cord is a very small, tight area and it is very susceptible to injury. And an injury in the spinal cord often does not recover well. And so the answer is yes, it could be cancerous, but even if it is not, it is a very dangerous thing to have. And it is possible that in spite of all treatments, the patient could lose function in their legs. But finding out exactly what the tumor is, trying to remove it if at all possible, and then depending on the type of tumor, often would need radiation treatment to follow.
And then, as you said, doctor, they tend to lose function in their legs. Why is it that the upper limbs are not so easily affected?
It would depend on where the tumor is. If the tumor is in the neck part of the spinal cord, that is known as the cervical spinal cord, it can affect the legs, the arms as well. If it is lower down, like between the shoulder blades or even lower, then it might only affect the legs. So location, again, everything to do with the nervous system, the location becomes very important. Brain, left side, right side, deep brain. In the spinal cord, it is whether it is in the neck part of the spinal cord or in the back part of the spinal cord that determines whether the legs and arms are affected or only the legs are affected.
And doctor, what would you say are the signs of a tumor in the spinal cord?
It could be weakness, clumsiness, numbness, and sometimes difficulty with urination and bowel control.
Usually, doctor, can spinal cord tumors be completely removed? Like, is it a completely treatable cause due to surgery?
It can be, yes. Again, it depends on the kind of tumor. Some of the tumors can be completely removed and they have a very good prognosis, while others are difficult to get a good complete removal and often need radiation treatment and things like that. And the outcome can be less successful.
And what do you think the prognosis looks like? Like, do you see a lot of your patients getting better, or is it like a more tougher thing to overcome?
Luckily, spinal cord tumors are relatively very rare. And so, and that's a good thing because the outcome, as I mentioned, the amount of space in the spine is very little. And so tumors in the spine that affect the spinal cord are in a very dangerous neighborhood. And even very small amounts of trauma, even the trauma of surgery, can make the patient much worse than they were even right at the beginning. But it is relatively rare, and it seems to be a little bit more common in children. So they often go to pediatric hospitals and pediatric surgeons.
So, as you said, it's harder for you to operate on these tumors because it might end up causing more damage. So, would you say that you'd recommend your patients to go for the non-surgical treatments over a surgical treatment? And what would the non-surgical treatments usually look like?
So the first thing you have to do is to establish a diagnosis. And that often involves a biopsy. A biopsy means opening the area involved and taking a small piece of it and sending it to pathology so that they know exactly what this is. And then, depending on that, there are some tumors that you do need to try and take out all the tumor, if at all you can, because that gives them the best outcome. And there are other tumors that it is not possible to safely take them out. And in those people, you would just do the biopsy, and after that, they would get radiation treatment.
Mhm. Mhm.
So, again, a lot depends on exactly what this is, and they often need a biopsy, which is taking a small piece of it through surgery to know exactly what's being dealt with.
And as similar to brain tumors, do spinal cord tumors also not really have a screening test as of now?
I'm sorry, I didn't hear the last part.
Oh, similar to brain tumors, would you say that, spinal cord tumors also do not have screening tests as of now, doctor?
Yes, there is no screening test.
Thank you so much for breaking that down for us.